Brain and heart conditions are leading causes of disease and death in Canada, with a devastating impact on patients and their families. New research is shedding light on the close relationship between cardiovascular diseases and brain diseases, such as stroke, dementia, cognitive impairment, and depression. Although closely linked, brain and heart diseases are usually diagnosed and treated separately. There is currently no brain-heart-focused clinical practice guideline published anywhere. The Brain-Heart Clinical Practice Guideline Project is an exciting new initiative that aims to change that, creating the first integrated brain-heart clinical practice guideline. The Guideline initiative is an integral part of a larger project called the Brain-Heart Interconnectome, or BHI. The Brain-Heart Interconnectome is an interdisciplinary research program aimed at accelerating the understanding, prevention, detection, treatment, and care of brain-heart-mind disorders. Supported by a $109 million grant from the Canada First Research Excellence Fund, the BHI initiative brings together leading brain, heart, and psychiatric researchers, along with patients, physicians, partners from academia, industry and government, and community organizations. The goals of the BHI are to understand and map connected brain and heart conditions, and to develop risk prediction tools and new treatments and interventions. The BHI project will also engage people with lived experience at each step of the process, and will work with Indigenous and high-risk ethnic communities to best meet their needs for brain-heart conditions. It will also train the first generation of research leaders. The Brain-Heart Clinical Practice Guideline program is a vital part of the broader Brain-Heart Interconnectome project. Its primary objective is to develop the first-ever guideline to assist clinicians and patients with the screening, diagnosis, prevention, and management of brain-heart connected conditions. The program will also evaluate the impact of these guidelines on clinical practices and patient outcomes related to brain-heart diseases. The guideline will address critical issues such as the best blood pressure treatment target to prevent both brain and heart disease, when to screen for depression in people who have suffered a heart attack or stroke, dementia screening protocols for people with heart failure, and much more. BHI reached out to the Canadian Cardiovascular Harmonized National Guideline Endeavour, C-Change, to manage the new guideline development. The process of creating a guideline starts with the needs of people with lived experience of brain-heart interconnected diseases. This inclusive approach will prioritize considerations of equity, diversity, and inclusion, including factors like sex, gender, ethnicity, accessibility, socioeconomic status, and other social determinants of health. To ensure that the guideline meets the needs of Canadian healthcare practitioners, ongoing education and knowledge exchange using the National C-Change Framework for Continuing Education will keep practitioners informed and engaged throughout development and rollout of the guideline. Implementation strategies will address the distinct needs of urban, rural, and remote regions. Decision aids and education programs will also help practitioners and patients put the new recommendations into practice. Ultimately, the Clinical Guideline Program aims to translate cutting-edge research on brain-heart-linked conditions into actionable guidelines, empowering clinicians to deliver higher quality care and improved outcomes for patients with brain-heart-related conditions. To learn more about the Brain-Heart Clinical Practice Guidelines, visit the C-Change website at cchangeguidelines.com.